Hello, this is Dr. İsmail Küçüker speaking here. I'm the chief and founder of the plastic surgery clinic of İsmail Küçüker. Now we are settled in Istanbul and we serve you in all fields of plastic surgery and dermatologic surgery in our clinic. Today, I would like to talk about what awaits you in nose surgeries and how everything will change during the process. In previous videos, I've talked about the transportations and the clinical aspects and the intervals of the surgery and how you will come, how you will contact us, and how we will guide you in the whole process. Now, I would like to talk more about the operation. What awaits you in the operations and what you will have to concern about in the nose surgeries. First of all, when we do the surgery, on the first 2 days, you will have increasing bruises and edema. Edema, what's edema? Edema is the swelling tissues. On the 48th hour of the surgery, you'll have the maximum edema in your mind. So also you'll have the maximum blockage. Generally, in nose surgeries, people never say that. I don't have pain. I never mention that I have pain. It's very rare that patients need painkillers in nose surgeries. What do people say? They say that my nose is blocked. Why is that? Because you will have also edema inside your nose, and then because of those, you will have some blockage in the early periods of the nose surgery. How long it will last? In the first 2 or 3 days, you will not be able to breathe from your nose well. When it does go back after the 4 days or 5th day of the surgery, generally you will be able to take some breath from your nose, but you will not have big pains and you will not have needs any painkillers in this process. Generally 10 patients, if having the surgery, 9 do not need even 1 tablets of painkillers, but sometimes, yes, you might have pains, but generally, it's not a painful procedure. What is the critical issue? The critical issue is you have to know that you will need some internal sprays for the blockage of the nose, which we will give to us. But even you use all sprays, you will have some blockage in your nose. That's the issue. After 2 days, you'll reach the maximum. And what about then? Then you will start to gradually decrease. What is the period? In the first week after the surgery, we will remove your external splints and the stitches, and then in that period, your edema will go just by 40%. So when you first see your face, you will see a swollen face. And generally, when patients see their faces first time, they look, it looks strange. Why it looks strange? Because you're used to with your old face and you say that, oh, come on, who is this? And this shock is generally normal and most of the patients have it. So I will tell you, no need to panic. This is just normal because your brain has, okay, this is not you who I am seeing in the mirror. And so it will be a shock for the brain. But by the time you will get used to your new appearance, even it's the perfect nose for your face, you can be shocked in the first days of the splint removal. And that's quite normal. No need to panic. It always goes by time. On the 10th day, generally you will be able to breathe more in from your nose, and then you will be able to sleep without taking any breath from the mouth, and all mouths closed. You can have a full sleep after 10 days from your nose. On the first month, generally 60 to 70% of the edema goes away, and the second month it reaches to 75 to 80%. On the third month it's like 90%, but in the 6th month you will have the final result both in the breathing issues and both also in the look. But if you have a thick skin is something very tricky. You will need more time to heal well because every skin has an edema capacity. If your skin is thin, its edema capacity will be less. But if it's thick, then more edema it can handle inside, so you will need more time to get rid of that edema. And in thick-skinned persons, the final result may reach sometimes 1 year and or even 1.5 years. And also, you might need some advices from us to get rid of the edema while in that period. So the final results need time, but in the first 2 months, you can have some panics because your edema will not dissolve symmetrically, and you can see some asymmetries in the early period, but we have to be patient enough, okay? This is quite normal, and we have to wait some time for the final result. So, in the future, if you have any problems with the surgery, you don't like it, you found it asymmetries, do you face these things? If you ask me, of course. If you're doing no surgeries, you can have your secondary surgeries. What is your secondary surgery rate? My secondary surgery rate in crooked noses is 10%, but in regular noses just 3%. Yeah, it's not zero, but it's quite low. If you will need any revision surgery, also we will guide you for the revision surgery, and it will not cost that high levels, and it will be just some simple fees like 500 to 700 euros or so for the hospital expenses, and then we will not take anything for the revision surgery if you want to continue with us whenever you need my help. Okay, these are the issues. If you're asking, everybody is always thinking that, okay, what happens if negative things happens? Yeah, if negative things happens, we will continue to guide you safely there in the whole process. Okay, that's the whole critical aspect. If you have any further questions, just you can mail us, just you can write us from WhatsApp, just you can write us from the Instagram pages, ask whatever questions you have, and we will guide you, we will show the truths about the nose surgeries, and we will be very happy to guide you for the whole process in İstanbul Küçüker, İsmail Küçüker Clinic. I wish you a very happy day, healthy day, and I wish you to see in our clinic in Istanbul for all kind of surgeries, for both just simple visits. We would like to welcome you. Bye-bye.